Imagine being told that type 2 diabetes is permanent, that medication is your only future, and that complications are inevitable. Now imagine being told the opposite, that, with the right nutrition and lifestyle, diabetes can not only be prevented, but reversed. This is the central promise of the end of diabetes. It challenges decades of conventional thinking and shows that food is not just fuel, it is powerful medicine. The book maps out how natural, nutrient-dense eating can restore insulin sensitivity, reduce or eliminate the need for drugs, and give back health that many thought was gone forever. The problem with conventional care: medications manage blood sugar numbers, but they rarely cure the underlying disease. A patient may take pills or insulin, but insulin resistance often worsens over time. Eventually, complications like nerve damage, kidney failure, and vision loss still appear. The traditional approach keeps people dependent on treatment instead of healing them. Example: a man who has been on medication for 10 years continues to see his dosage increase, yet his eyesight begins to blur. His body is not being healed. The disease continues beneath the surface. Research from the New England Journal of Medicine confirms that drug therapy lowers blood sugar, but does not significantly reduce long-term complications. Food as medicine. The program in this book is built on a concept called the Nutritarian diet, which emphasizes foods rich in micronutrients. The higher the nutrient per calorie ratio, the more healing the body experiences. Vegetables, beans, fruits, nuts, and seeds are the foundation. Processed food, animal fats, and sugar are minimized. Example: a woman with high fasting glucose shifts to meals of leafy greens, beans, and berries. Within weeks, her glucose readings improve, and her doctor reduces her medication. Studies at Harvard show that plant-based diets improve insulin sensitivity and lower HbA1c more effectively than standard diabetic diets, breaking the addiction to processed foods. Processed foods trigger cravings and overeating. Sugar and refined grains spike insulin, leading to crashes and more hunger. This cycle keeps blood sugar unstable. Example: a man who ate pastries for breakfast begins with oatmeal topped with nuts and fruit. His morning energy stabilizes, and afternoon crashes disappear. Research in neuroscience reveals that sugar activates reward centers in the brain in the same way addictive substances do, proving why processed food is so hard to give up. The power of greens. Leafy greens provide antioxidants, phytochemicals, and fiber that directly lower inflammation and improve vascular health. They help protect the pancreas and improve blood vessel function. Example: a retired teacher adds large salads daily with kale, spinach, and avocado. After 3 months, her cholesterol drops, blood pressure normalizes, and her diabetes medication is cut in half. Clinical studies confirm that high intake of leafy greens lowers diabetes risk by more than 14%. Beans and resistant starch. Beans and lentils are a cornerstone of this program. Their resistant starch slows digestion, keeps blood sugar steady, feeds healthy gut bacteria that improve metabolism. Example: a man replaces white rice with black beans at dinner. His glucose monitor shows flat, steady readings instead of sharp spikes. Research from the Journal of Nutrition demonstrates that beans reduce post-meal glucose spikes more effectively than whole grains. Fruit as a healing food. Many people fear fruit because of its natural sugar. This book shows that fruit packed with fiber and phytonutrients does not cause harmful spikes like refined sugar. Instead, it nourishes cells and helps repair damage. Example: a woman replaces cookies with apples and berries. Her HbA1c levels improve within months. Studies from Oxford University confirm that fruit consumption is associated with reduced diabetes complications and lower mortality. Fat that heals. Healthy fats from nuts, seeds, and avocados improve insulin sensitivity and protect the heart. Unlike processed oils and animal fats, these whole food fats contain nutrients that lower inflammation. Example: a man adds ground flax seeds and walnuts to his breakfast. His triglycerides decrease and his glucose readings stabilize. Research in the American Journal of Clinical Nutrition shows that nuts improve glycemic control and reduce cardiovascular risk in diabetes patients. Exercise as a natural insulin. Movement is medicine. Muscles act like a sponge, pulling glucose from the blood without requiring extra insulin. Both aerobic activity and strength training increase glucose uptake. Example: a woman walks briskly after dinner every night. Her post-meal glucose readings are significantly lower. Research from Stanford University shows that just 15 minutes of walking after meals reduces glucose spikes by 20 to 30%. The role of weight loss. Excess fat around the liver and pancreas drives insulin resistance. Even modest weight loss can restore function and reverse diabetes progression. Example: a man loses 20 pounds by following the program. His fasting glucose drops from 160 to 100, and his doctor discontinues insulin injections. Studies from Newcastle University confirm that weight loss through a nutrient-dense diet restores pancreatic beta cell function, ending medication dependence. The most powerful claim in this book is that many people can eventually stop medication if they commit fully to the program. By normalizing blood sugar naturally, drugs become unnecessary. Example: a patient on 2 types of insulin begins the Nutritarian diet. After 6 months, she no longer needs insulin, and her doctor celebrates the reversal. Clinical trials have documented full medication withdrawal in patients adopting intensive lifestyle change. Long-term lifestyle transformation. The 30-day or 90-day healing phases are not short-term diets, but a reset that leads to lifelong health. Once cravings fade and energy returns, the new way of eating feels effortless. Example: a man who once lived on fast food now prefers homemade lentil stews and giant salads. He no longer craves fried foods. Behavioral science shows that taste buds adapt within weeks, making healthy foods the new source of pleasure. Closing challenge. Diabetes is not a life sentence. It is a warning, and it can be reversed. The cure is not found in a pill, but on your plate, in your sleep, and in your daily choices. The challenge for you is simple. For the next 30 days, build 1 meal a day around greens, beans, berries, and nuts. Watch what happens. Your body is waiting to heal, and the end of diabetes can begin with your very next bite. Your journey to better health starts here. Subscribe now for fitness tips and natural diabetes reversal guides. Take care, stay healthy, and see you in the next video.